veterinarian, and we're talking about the Zika virus. So much is being talked about this virus, so many concerns and fears over what it can cause, what it can do, and so we wanted to make sure that we set reality versus myth, or realities versus myths. And so what is Zika, Dr. Brown?
Zika virus is a mosquito-borne infection that's transmitted in tropical and subtropical parts of the world. Typically, most people who are infected with Zika virus won't even know that they were infected because they won't develop any symptoms at all. Those who do get ill, about 20% of infected people, will develop a typically mild illness associated with fever, rash, joint pain, and conjunctivitis, or redness and irritation in the eyes. Serious complications requiring hospitalization or death associated with Zika virus is extremely rare. What we're seeing right now is a large outbreak of Zika virus infection in Latin America and the Caribbean. This includes Mexico, the Caribbean, Central and South America. The virus is expanding rapidly to different countries and causing large numbers of cases. And what we're seeing with this outbreak is an apparent association between Zika virus infection in pregnant women and a birth defect called microcephaly in their infants. And it's this association that has public health officials and healthcare providers concerned about the virus.
So if you're joining us right now on Facebook Live, this is really the expert. I called her the know-it-all when it comes to Zika, right? Our point person for the state on Zika virus. And Zika virus is something that's being talked about around the country. And we wanted to make sure that we dispelled any kind of myths and really talked about reality as we get into the spring and summer travel season, as we get into mosquito season, so that we have a good, honest discussion, so that we don't see what we saw when we had the discussion about Ebola. Remember that?
Yes.
Everyone thought they were going to die of Ebola. It got blown out of proportion, and nothing really happened. Beyond 5 cases, I believe we didn't see many cases around the country or the world.
Not many, right.
So we want to put this in perspective. So we invited Dr. Jen Brown, who's our point person with the Indiana State Department of Health, to come on in and answer your questions. So we want to welcome you to Facebook Live. If you have any questions, we look forward to seeing you add some of your comments and join our conversation. So we are getting ready for spring travel, right? Spring break. Kids love to go south. Some of those destinations are Acapulco and those kinds of places. What do we tell our kids as they travel south? As we begin to prepare to go on summer vacation,
Right.
What do we do?
Right, so we do have some recommendations out there for people who are considering travel. Women who are pregnant are being advised not to travel to areas where Zika virus transmission is actively occurring.
At all?
At all, if it can be avoided. If it's elective travel that can be postponed, we would certainly recommend that pregnant women postpone their travel because of this concern over the association between Zika virus and birth defects in infants. If pregnant women must travel, then they're encouraged to take rigorous precautions against mosquito bites, and we can talk in a few moments about what that would entail. Some news that came out last week is that we have seen some sexual transmission of this virus in a very small number of cases. So the main way the virus is transmitted is through the bite of infected mosquitoes, but there's a very small number of documented cases of sexual transmission. And so another recommendation is that men who are traveling to countries where Zika virus transmission is occurring and who have pregnant sex partners should either abstain from sex or practice safe sex through condom use for the duration of their partner's pregnancies. Everyone else who's considering travel has to weigh the risks of Zika virus exposure against the benefits of travel or the goals that they hope to accomplish with their trip, and just make the decision that feels right to them. And if it does feel right to go ahead and book that trip, then we would encourage anyone who's traveling to take precautions against mosquito bites. This would include wearing long sleeves and long pants to reduce the amount of skin that's exposed to mosquitoes, staying in accommodations that have air conditioning or screens to keep mosquitoes out of indoor areas, wearing EPA-registered insect repellents, and consider using a product called permethrin, which you can use to treat your clothing to keep mosquitoes away.
Can I buy that product anywhere, or do I have to order that product?
That's something that you would find at a sporting goods store or an outdoor recreational activity store.
And does it say Promethean on it, or does it come under different name brands?
You would look for something with the active ingredient called permethrin, and I should say permethrin is something you would only apply to clothing or to items like sleeping bags or tents. You would not apply this to your body. That's correct.
In any capacity, so no face, no eyes,
that's
no,
right.
just to the clothing.
That's right.
clothing or just the...
Just to clothing or other items like other cloth items like your tent or sleeping bag or something like that. It's just another measure you can take to keep mosquitoes away from you or not attract them to you.
And after use, would I have to wash that separately from other clothing? If I apply that chemical, how would I use that after the fact?
That's something you would need to follow the label instructions of the
So make sure you
product,
do that.
and those instructions for how to launder the product afterwards should be included on the label.
So we're talking about the Zika virus, a very important public health issue, and we don't want you to be alarmed. So this really discussion with Dr. Jen Brown with the Indiana State Department of Health is we're putting this in perspective so that when you hear about it on the nightly news or on RTV6 News, you can say, I know about it, I know what to do, I know how to handle this. We're getting some of the dialogue now coming in. One of the questions that people have is, we're going to head into mosquito season in Indiana. I think I saw a mosquito the other day when it was 60 degrees. So how do I know, if I get bitten by a mosquito, that I should not get alarmed that, oh my goodness, I've been bitten by something with Zika or even West Nile or one of the many other diseases that mosquitoes carry?
That's a great question. So one thing that we're trying to put out there in our messaging is that we think that the risk of a Zika virus outbreak occurring in the state of Indiana is currently low, based on what we know about the biology of this disease. Zika virus, we know, is capable of being transmitted by 2 different types of mosquitoes, and the most effective mosquito vector of Zika virus disease is not a mosquito that's even present in the state of Indiana. So, that's something that reduces our risk right there.
We have some questions that are coming in.
Yeah,
I'm going to
please.
get closer to the camera because
Okay.
hard to see. Wendy Scott wants to know, Wendy Scott Vest, what's the risk to people who are not pregnant? It's from Wendy Scott Vest. She wants to know that.
Yeah, the risk to people who are not pregnant, that's a great question. So 80% of people who are infected with this virus will not develop any symptoms at all. You may be infected and bitten by an infected mosquito, develop an antibody response to the virus, but not even know that you were exposed because you never have any symptoms. About 20% of people, 1 in 5 infected people, will develop what's usually a mild illness, and the typical symptoms would be fever, rash, joint pain, or conjunctivitis, redness and inflammation in the eyes. Hospitalizations or deaths associated with Zika virus are extremely rare. So the risk to someone who's not pregnant is that you might develop what's usually a mild illness. Should also say that men who have pregnant sex partners should take special precautions because if they're infected, there's a chance that they may transmit the virus to their sex partners, and of course we want to protect pregnant women from exposure to this virus.
So we want to thank you for joining us on Facebook Live. Your questions are coming in, so we want to thank you for the questions and being part of the discussion. Wendy Scott Vest, thank you for that question. We have another question, this one from Laura Quintanilla. I hope I pronounced your name correctly. She wants to know, once you get it, do you always have it?
That is a great question. So we think that the virus reaches its highest levels in the bloodstream in the first week after your symptoms begin. In other words, the first week of your illness. Following that first week of illness, the virus is not expected to remain in the bloodstream for long periods of time. It's that first week of illness that we think people are capable of serving as a source of infection to others if mosquitoes bite them. And so that's why we're telling healthcare providers, if you have a patient that you think might have Zika virus infection, please ask them to remain indoors and to avoid mosquito exposure for the first week of their illness to reduce the chances that mosquitoes will bite them and then transmit the disease to others. I know one question that a lot of women are wondering is if I'm exposed to this virus, if I'm infected with this virus while I'm not pregnant, would that have an impact on my future pregnancies? And the answer is we don't have any evidence to suggest that that's the case. In other words, at this time, for women who are not pregnant, who are infected with the virus, we don't think that there's any harm done to future pregnancies.
We want to thank Laura Quintanilla. Thanks that we pronounced her name correctly. So Laura, thank you, and thank you for that question. We also have a question from Brittany Gerke. She wants to know what countries carry this. I think you mentioned many of them are south of the United States.
Yeah, to be honest, there's too many for me to list here, and so what I would encourage your viewers to do is to visit the website of the Centers for Disease Control Control and Prevention, or CDC. They have a dedicated website with Zika virus information, and one of the highlights of that website is a list of countries where Zika virus transmission is actively occurring. There's more than 24 countries impacted by the virus at this time, so really you need to go to that website to get the most current information.
But you mentioned earlier countries like Mexico,
Yes.
countries in the Caribbean,
Yeah.
South America.
Yeah.
And that's just that gives you a taste for where we're going.
Right. If you're planning or considering travel to Mexico, the Caribbean, or Central and South America, then I would encourage you to check that website to see if the country in your travel plans is included on the list.
How do you monitor this? I mean, we are now a global society. We're all traveling. We're all getting those super saver fares to those hotspot destinations. How do you really monitor as people go everywhere?
Yeah, that's a great question. And we monitor mosquito-borne infections in two different ways. We monitor for cases of infection in people, and then we also monitor for the presence of the disease in mosquito populations. And at the Indiana State Department of Health, we're already doing surveillance for human cases of a large number of mosquito-borne infections, not only Zika virus, but also mosquito-borne infections that we know we have right here at home in Indiana, like West Nile virus. So under state law, when a doctor or a laboratory makes a diagnosis of one of these infections in a patient, they're required to notify us so we can do a public health investigation, determine the source of infection, and then determine whether there's a likelihood that there's a risk to the community at large. And then the other activity that we do at the Indiana State Department of Health is we have a team of entomologists that's doing surveillance for mosquitoes in every single Indiana county every single summer, testing them for viruses like West Nile virus. And so if we had evidence that there might be local transmission of Zika virus occurring in our state, we would very quickly implement testing of mosquitoes to determine the extent of the risk, so we'd be able to notify the public quickly.
You notified the public on Tuesday about the first reported case. Can you talk about the case now? When we talk about health, because of HIPAA rules, you're not going to get any names, you're not going to get any personal information, but can you give me the big picture? You reported that first case.
Yeah.
Can you let folks know what that means and what that looked like?
Yeah, so this was a patient who presented to their healthcare provider with a relatively mild illness. The patient has since made a full recovery, did not require hospitalization for the illness, and this patient did have a history of travel to Haiti, which is a country where we know Zika virus transmission is actively occurring. I have to say this is something that we were expecting to happen because the epidemic in Latin America and the Caribbean is so large, and there's so many people impacted by the outbreak in those areas that we felt sure that we would see cases in people who had traveled to one of those countries and then come back home to Indiana. So this is something we were anticipating. We do expect to see more cases in other travelers returning from those affected areas. The risk to the general public associated with the identification of this case is minimal. We don't expect there to be any risk of further transmission associated with this particular case.
Our conversation continues on Facebook Live. We want to thank Dr. Jen Brown. She's the state public health veterinarian, and she's the one who's monitoring for the state, the point person on Zika. And we invited her to sort of dispel the myths and give us the realities. So we want to thank you, and continue please asking and posting your questions as you post them. I'll make sure to ask them. And Brittany Gerke says, I have a friend traveling to Mexico for vacation. What would be a way to help protect themselves from Zika? That's from Brittany Gerke. Brittany, thank you so much for asking that question.
Yeah, that's a great question, Brittany. If your friend is pregnant, you didn't mention if your friend was a pregnant woman. If your friend is pregnant, I would...
Hold that thought. So Brittany, if you can give us more information, if you want to share, post it on there so she can give you more information. You were saying.
Yeah. So, pregnant women are being advised to avoid or postpone travel to countries where Zika virus transmission is occurring. But I think Brittany may be asking a more general sense of how do I protect myself against mosquito bites while I'm traveling. And there are a few things that people can do. One thing is simply to reduce the amount of skin that's exposed to mosquitoes when you're outdoors by wearing long sleeves and long pants. Another thing you can do is to stay in accommodations that have air conditioning or screens to keep mosquitoes out of indoor areas. areas, wearing EPA-registered insect repellents, wearing a product called permethrin, we mentioned a little bit earlier in this recording, that can be used to treat clothing. And I should say that these...
Is that safe for pregnant women, though, even to be around that kind of chemical?
The EPA-registered insect repellents are considered safe and effective for use by pregnant women, as well as people who aren't pregnant.
That's good to know.
And I should say that using these precautions won't only protect you against Zika virus while you're traveling. There are other tropical mosquito-borne infections out there, like chikungunya virus and dengue viruses. And so these prevention measures...
One virus at a time.
Yeah.
One.
I guess what I want to say is if you protect yourself against mosquito bites, you're getting a lot of bang for your buck, because you're protecting yourself against more than one possible infection while you're traveling.
When we saw the Ebola virus, we saw that the response that required the spacesuits and all the drama. If we see cases of Zika, will they have to be treated in the same way, or is that a different response to something like that?
That's right. It is a different response. So Ebola is a virus that's transmitted in multiple body fluids, and it's very contagious. It's important to remember that Zika virus, the main way that this virus is transmitted is through the bite of an infected mosquito. In other words, if I were infected with the virus and had high levels of the virus in my bloodstream, we could be standing right here, this close to each other, but the main way that you would be in danger of getting it from me is if a mosquito bit me and then bit you after it took some of my blood.
So the odds are very high.
Yeah, so it's a lot different from Ebola virus, where you can pick up the virus from direct contact with people or things like that. So there have been a small number of cases reported of sexual transmission of Zika virus, but really the main way, the favorite way for the virus to be transmitted is through the bite of infected mosquitoes. And so taking mosquito prevention measures while you're traveling is going to be the most effective way to reduce the risk.
And Doc, by the way, Brittany tells us that her friend is not pregnant at this time, but they are trying to get pregnant. And you mentioned that should not be a major concern as long as they practice.
Right. So the main concern, or the main guidance for travelers, is limited to women who are currently pregnant. There's no advisory against women who are trying to conceive, and in fact, we think that even if your friend is infected while she's traveling, once that virus has cleared her system, which again we think takes about a week, we would not expect there to be an impact on any future pregnancy.
So how do I know? Sometimes the symptoms to many of the viruses are similar. So how do I know that I don't have Zika and I may have the flu or some other disease that has the same, high fever, cramps in the stomach, right? How do I tell the difference? Do I have to go to the doctor and say, hey, get me tested, give me the Zika test?
Yeah, that's a great question.
Is that a blood test? How do you
It is a blood test, and it's a great question to bring up, because we are in the middle of flu season when a lot of people have illnesses with fever. So really the combination of symptoms with Zika is important to look for, not only fever, but also conjunctivitis or pink eye, joint pain, and a rash. And the rash usually appears like red polka dots, is the type of rash that we see. So a person who has maybe 2 or more of those symptoms, I would encourage them to talk to their healthcare provider about their symptoms and let the healthcare provider know of the travel history, so that the healthcare provider can make an assessment of whether Zika virus testing would be a good idea.
We should point out that you are the state public health veterinarian.
That's right.
And I asked you, what is a public health veterinarian doing about Zika? When I think of a vet, I think of horses and cats and dogs, but you explained it very well.
Yeah, so I'm a public health veterinarian, which means that my responsibility is for the surveillance, prevention, and control of diseases that are transmissible between animals and people, as well as diseases that are transmitted by vectors like mosquitoes and ticks. And so I'm the veterinarian at the State Health Department that's responsible for prevention of that group of diseases in Indiana residents.
We want to thank you for having this discussion with us on Facebook Live. We want to thank you for all your great questions, and of course this will be on our Facebook page on the RTV6 side throughout the day if you want to see more of this taping, or if you want to go back and take some notes. Thank you so much for putting this in perspective. We hope that you folks at home understand not to be alarmed, and if new information comes out, we'll ask Dr. Jen Brown to come forth and share that information.
It's been a pleasure.
Will you come back?
Yeah, of course. Thank you for having me.
We thank you for watching Facebook Live. Have a great day.